Tellico Village Broadcasting, your source of programming highlighting active lifestyles in our beautiful surroundings.
I'm Rick Blau, President of your Tellico Village Board of Directors, and I have a message I want to deliver today. In a time of so much uncertainty and uneasiness, it's normal for all of us to look for a sense of reassurance and order. By now, I'm sure most of you are tiring of the almost constant barrage of information about coronavirus or COVID-19. Your board and POA management are continually monitoring announcements and information that are critical to making the decisions that support our primary goal, to keep the health and safety of our residents, guests, and staff our highest priority. We've made the communication of new developments to you among our most important objectives. When all this started, I asked myself, what is COVID-19? So I did what you probably did. I researched it. According to the World Health Organization, COVID is a respiratory virus with its presumed origin in Wuhan, China. They have opined that this is a global pandemic impacting every nation. It spreads person to person via respiratory droplets produced by coughing or sneezing. Its symptoms, which can range from mild to severe, may occur 2 to 14 days after an exposure. They include fever, a cough, and difficulty breathing. In many cases, much like a bad cold or the seasonal flu. Sometimes symptoms don't even present, but you can still infect others. The disease is especially dangerous in at-risk populations like those 60 or over in age and those with serious underlying medical conditions or weakened immune systems. The Centers for Disease Control advises anyone displaying symptoms of COVID-19 to self-quarantine, call their doctors, and seek medical advice before going to their offices. You can get additional information and the answers to your questions on the CDC website at www.cdc.gov/coronavirus. So where do we stand right now? Through the Tellico Village Volunteer Fire Department, we are receiving daily updates from the Tennessee Department of Health. As of March 23rd, there were 615 cases in Tennessee. Of these, 1 is in Loudoun County and 2 are in Monroe County. The Loudoun County case triggered a move by the fire department from readiness condition 4, which is its lowest level, to readiness condition 3. There are a total of 4 levels, each triggered by a COVID-19 event. Each level calls for an alteration in the emergency protocols to provide effective emergency response while protecting responders. Your POA has been constantly monitoring progress of the virus and has taken the following actions in a stepwise fashion in accordance with CDC and state guidelines over the past 2 weeks. All POA board meetings have been closed to the public, starting with the March 18th meeting. That meeting was recorded and is available for viewing on the POA website's board page. Your board will continue to meet in this manner for the foreseeable future, as it is essential that it continues to oversee village operations. All advisory committee meetings have been closed to the public, and the groups have been asked to either meet electronically or if face-to-face meetings are absolutely necessary to practice social distancing. And I'll talk a little bit more about that later. All food service facilities have been shuttered. Curbside takeout and delivery from a modified menu is available at the Blue Heron Restaurant, at the Yacht Club, and the Kahiti Grill from 11 a.m. to 7 p.m. 7 days a week. Patronize your restaurants here in the village. The golf clubhouses have been closed except for the restroom facilities. You can still play golf by phoning the pro shops and registering and paying remotely. You will then proceed to the cart staging area where disinfected carts will be available at 6-foot intervals. The starters will check you in via tablet computer while maintaining a proper distance. All carts will be single occupancy, except in the case of 2 people from the same household playing together. All recreation facilities are closed, including the Wellness Center, Chota Rec, the Kahiti Fitness Room, the tennis and pickleball courts, and the playgrounds and pavilions at Tugaloo and Kahiti. Our walking and hiking trails are still available, but please observe proper distancing. The lobbies of the Welcome Center and the POA administration offices are closed. If you need to transact business, please call or email before you go. It is important that we protect those who work for us. I know that these measures appear draconian, but they are intended to protect all of us as well as the employees that provide our needs every day. The changes are effective through April 6th. After that, we will reevaluate based on current data. Here are some other things that you need to be aware of. As of March 22nd, T-BART has suspended their lake rescue services until further notice. Boat US continues to provide services, but only to its members. On March 23rd, the library at Tellico Village announced its closure until further notice. All Tellico University classes have been suspended and will be rescheduled at some point in the future. Governor Bill Lee announced effective March 23rd, mandatory closures of gyms and fitness centers, limitation of bar and restaurant operations to takeout, delivery, or drive-through, and prohibitions on gatherings of over 10. A number of businesses like pharmacies, grocery stores, and other essential services are maintaining special hours for seniors. Please call them directly to ascertain when these services might be available, as this is changing daily. You might ask, what can I do to protect myself and those around me? Well, here are some suggestions from the CDC that I encourage you to heed, as indeed I will. Wash your hands often, for 20 seconds with soap and water, or use a hand sanitizer that is at least 60% alcohol, especially after being in a public place or after blowing your nose, coughing, or sneezing. Stay home if you are sick, except to go to the doctor. Avoid contact with people that are sick. Avoid groups larger than 10. Practice social distancing by maintaining a perimeter of at least 6 feet from anyone else. Clean and disinfect frequently touched surfaces at least daily, including tables, countertops, doorknobs, light switches, handles, desks, phones, keyboards, sinks, and toilets. If you run out of disinfectant, you can make your own using household bleach, mixed 1/3 of a cup to 1 gallon of water, or 4 teaspoons per quart. If you have recently returned from a trip and we're a well-traveled village, please self-quarantine for 14 days. During this time, communications is a key requisite. I want you to be aware of developments so you can make the best decisions. Your POA board and staff have implemented its crisis communication protocols to assure that important information is available to you. Our official vehicle for this is the Telegram. If you haven't already subscribed to this vital information lifeline, please do it now. You can sign up by calling the Welcome Center or on the homepage of the POA website. Periodically, I'll update you on new developments. In the meantime, please follow the CDC guidelines and recommendations, and above all, stay safe.